Hi everyone, welcome back to the Dr. Sia channel. In this video series of 10 common mistakes that ISTDP practitioners make and how to kind of overcome them, we're going to be talking about the common mistake of assuming an internal problem. Let's get started. Alright, so assuming an internal problem. I can't say the number of times that I myself as a practitioner or my students or my colleagues have shown me videos, or I've watched my own videos, or I've shown my video to my supervisor, and we've found that the problem has been that someone, me, the practitioner, has, or my student or my colleague has assumed that there is an internal problem. Now, what I mean by that is that psychotherapy, or ISTDP, intensive short-term dynamic psychotherapy, is a psychotherapy that works on people's internal problems. What I mean by that is we work on what happens within the person, and we assume that working on what happens internally for the person, making health changes internally, changing the way people think about themselves, the way they feel, and the way that kind of their tendencies are for behaviors, that it will ultimately result in a lot of life improvements. But just because we think or we want there to be an internal problem, because that's kind of what we work on, doesn't mean that there is one. A large majority, if I would say 90% of my patients, come to therapy with an external problem. It is very rare that my patients come and say, I have an internal problem like anxiety, and I believe that that internal problem with anxiety that I have results in problems in my relationship because of problems that are within me, not with my partner, and I believe that they are kind of attachment related and they go back to my background and my issues, and I want to look at them. That is extremely rare. And I would say about maybe 10% of the time the person actually comes with some variety of what I just said, where they kind of say I have an internal problem and I think that it causes problems for me in my life, and I want to deal with the problems that my internal problem causes for me. More often than not, people come and sit down and it's about external problems. It's about how they might say, yeah, I'm anxious. Why are you anxious? Well, you know, people keep criticizing me. People keep judging me. People keep mistreating me. Well, I have a lot of stress at work. Well, you know, COVID happened. Yeah, well, you know, since I broke my leg, since I've had this back injury. All of these things are external problems. All of these things are external problems. They are not internal psychological problems. They are external to the internal psychological problems. The person is now complaining that if only their leg was working, then they would be fine, and that they're not doing well at work because of their leg. Again, that's not external to the person, but it's external to their mind. It's now about their leg. And there are, I suppose, different ways to deal with when the person is externalizing, when they're saying that they're, and don't get me wrong, I don't mean externalizing as in externalizing the idea. There are many types of externalizing. Anyway, the kind of externalizing that I mean here is the type where they go, the problem is not psychological, it's something outside of me. There are many ways to deal with that, but I'm going to cut it short and say how I deal with that so that you, if you're an ISTDP practitioner, might find that useful. You have to kind of go with it. You can't just block the person's external problems. You can't, because it's too combative at that point. You don't know the person yet, and they come with their complete understanding is that if only workplaces were nicer, they would be fine. That's their understanding in that moment. They think that if workplaces were better, then they would be fine because they wouldn't be stressed and they wouldn't be anxious. They don't know that whatever happened for them in their childhood with their attachments, their internal structure, is what kind of makes them vulnerable and hurt and more easy to get hurt in stressful situations. They don't know that. What they think they know, or what they know, is that if workplaces just changed, if all of them just changed, then they would do better. So there are kind of things to do about that. One kind of old school, I call it old school strategy, is to say, well, we can't do anything about your workplace right now, so let's kind of look at what happens within you instead. Fair enough. It's a way to block the externalization, block their ideas about what happens in their workplace, and kind of look inside instead. That's kind of one way to do it. But the way that I would kind of do it is go, all right, so let's take a look at your workplace. Yeah, it's very stressful. And you kind of have this idea that stressful workplace says what kind of results and what happens within you. So perhaps it's best then that we kind of just change all of the workplaces in the world. That if all of the workplaces were different, then you would be fine. How do we do that? Now, as I say that, I kind of realize that a lot of what I just said there is my supervisor's words coming through my mind. And if you haven't looked him up yet, look up Dr. Stephen Arthy. He's a phenomenal therapist, a phenomenal teacher. And if you're ever thinking about doing ISTDP training, please look him up, Dr. Stephen Arthy here in Australia. Now, so I'm not trying to steal it. Stephen, if you're watching this, I'm sorry. I can't help but kind of channel you through me here. All I'm kind of just talking about is when a person externalizes, you have to go with it. Doesn't mean that you go with it and you never stop it, but rather than just kind of jaggedly putting an immediate stop to it, go with it, check it, see if you can help them understand that their perpetual look at everyone and everything except for themselves is not going to help them resolve the issue, right? Help them just see that, okay, so if we then kind of change that workplace, right? So you change that workplace and then you change that workplace and then you change that workplace. So if you do that, then you would feel better? Yeah, I sure would. Okay, so how do we achieve that right now? Well, then now you're getting the person to kind of defeat their own defenses. They might go, well, we can't do that. All right, so there's kind of a sense though, there's an idea though that if we just can do that, then you'd be better. Yeah, even though you kind of know that there's no way you could do that. Yes, and then you can help them look deeper. You know, you can help them, for example, you could say, do you have a tendency to look outside of you instead of inside of you to resolve issues? Are there other areas in your life where you have problems and you're looking to solve the problem by changing the world instead of changing yourself? Is that a tendency for you? Do you tend to do that? Yeah, actually, I've realized I always do that with my partners too. Every time I have problems in relationships, I just change partners. Okay, is there anything else that you do that with? Yes, I do that with friends. Yes, I do that with countries. Yes, I do that with... Now you're helping them explore this tendency they have for externalization, and you're helping them see if they want to kind of let go of that and engage with you in an internally driven psychotherapy. So as you're kind of helping them see that, you say, well, it seems that your tendencies are to look away from you and look outside of you. Psychotherapy, however, is a process where we assume that we can help you through looking inside and making changes inside so that you can deal with your world better. Is that something that you would like to do? Now, more often than not, if the patient actually agrees, you might see them sigh. You might see that actually you've gotten past a massively syntonic defense, or it might not be a defense at all. It might just be that that's the way, it's a barrier to therapy, that it's just the way that the person kind of deals with their world. And that's the way that they were going to deal with you two in therapy. And you might not kind of see them straight up and sigh or whatever, but you might see them start getting a bit anxious. Because now all of a sudden they're doing something with you that they haven't done before. And in my experience, what to look for right behind externalization is projection. Very often, as soon as the externalization releases and the person says, all right, so let's look inside then, they get anxious, and then projection pops up, because as soon as you are not there with them to solve the world, solve their job, solve their partner, solve something else, then they look at you. Then more often than not, a very other common defense kind of pops up, which is projection. Just lies right there underneath the surface. It may or may not, but it's worth looking for. So once you've dealt with externalization, look for projection. Now, I hope I gave you kind of enough to really think about this idea that it's best to not assume that your patient has an internal problem. It's best to kind of assume that they might actually not. In my experience, 90% of the time, they don't have an internal problem. But that doesn't mean that that's a problem in itself. We can help them see that and guide them back to an internal problem. And if they want to work with you, if they think that they would benefit from working with you and they want to work on an internal problem, then you can do that with them. And if they don't, well, that's their choice. So I hope you enjoyed this video, and in the next video, we're going to be talking about overemphasis on feelings in ISTDP. I hope you enjoyed this one. Please subscribe, please like, please comment. This one is for the ISTDP therapists out there, so please let's start a discussion on whatever you find. Let me know if you have other ways to deal with the same kind of defenses that I talk about and with the same barriers to therapy. I'd be really curious to know. I really appreciate your support. Thank you so much. Let all your colleagues know what we're trying to achieve here on the Dr. Sia channel. Thank you so much, and I'll see you next time.